Hello, good afternoon everyone. I am Sheila Suplig and I'm going to be discussing topics regarding abortion. So the topics that I would be discussing includes the definition and types of abortion, pathophysiology, signs and symptoms, diagnostic tests, medical and surgical management as well as the NCM. So, to define abortion, abortion is a medical term for a disruption of a pregnancy before the fetus reaches its viable age of 20 weeks of gestation or weighs at least 500 grams. So, abortion usually happens during the first trimester of the pregnancy. It happens before even the fetus reaches its age of viability. So when we say age of viability, it is when the fetus is developed for for at least 20 weeks, or if it weighs more than 500 grams. So if the fetus is delivered before of its age of viability, this can be considered as abortion. So to discuss the types of abortion, we have 6 types of abortion. The first one is the threatened abortion. So it is when the embryo is already viable and the products of conception are still intact and the cervix is closed but there is a vaginal bleeding present. So here's a threatened abortion. From the word threatened, it means it is in the verge of being aborted. So the fetus is at risk for being aborted. So here, present pa yung FHR ni baby and also intact pa si baby sa mismo uterine wall. Pero the problem is, threatened abortion can always lead to complete abortion or just abortion in general. At this phase or at this type of abortion, it is important to monitor the baby's condition and also to give interventions to make the baby or mas kumapit si baby sa mismong uterine wall ni mother. So next is yung inevitable abortion. Inevitable abortion is the embryo is dead with the products of conception either intact or expelled. The cervix is already dilated and there is a presence of vaginal bleeding. So sa inevitable, from the word nga na inevitable, walang choice kundi ma-expel si baby from the uterine the intrauterine part ni mother kasi this is when yung baby is nagdetach na siya dun sa uterus. So usually si baby here wala na siya ng heart rate, pero may possible pa din na may heart rate pa rin si baby. Pero in most cases si fetus do not last for days even if na expel siya na may heart rate, kasi since under the age of viability pa din yung fetus, hindi makakasurvive si baby kasi hindi siya fully developed. Then next is yung incomplete abortion. So from the word incomplete, all products of conception, are expelled. Also, there's something wrong with my PowerPoint, pero it should be complete yan. Complete abortion, all products of conception are expelled and the embryo is dead. The cervix is dilated and there is a mild bleeding. So from here, from the word complete, it means that all of the product of conception, including the fetus inside the uterus, are expelled because of complications. It may be infection or just because the baby isn't strong enough to stay inside the uterine wall. Yan. Next is yung incomplete. Yan. Incomplete abortion is when the embryo is dead but some products of the conception are still intact. and the cervix is already dilated and there's a severe vaginal bleeding. So from here sa incomplete, from the word incomplete, it means may mga residue pa inside of the uterine wall. So, hindi lahat ng products of conception is nailabas na. So, there's a severe bleeding because hindi nga nailabas masyado yung lahat na products of conception. And also, the fetus is dead from here. Next is yung missed abortion. It is when the embryo is dead while inside the uterus. So, the products of conception are still intact and the cervix is closed. There are brown vaginal discharges present. So, minsan, there are times that si mother hindi aware na nagkaroon na siya ng abortion. So, eto yung missed abortion na sinasabi. Magtataka na lang sila, wala ng FHR. Yun pala, na-abort na without even bleeding. So, lalabas pa lang ng discharge after the abortion. When we say missed, nakaligtaan. Ayan. Next is recurrent or habitual. So, abortion becomes recurrent once the woman has had 3 consecutive miscarriages at the same gestational age. So, it happens if si mother is nagkaroon na ng abortion for 3 consecutive times na sunod-sunod. Ayan. So, next is yung pathophysiology ng abortion. For pathophysiology, we'll start with the risk factors. Of course, from the fetal side or the fetal factors, nandiyan na si abnormal development of the zygote. And then, for maternal factors, there's risk factors of infection, systemic disease, exposure to radiation, reproductive system anomalies, and drug ingestion, and of course, age, maternal age. So, all of this might cause abortion. Next is yung placental factors. There are some abnormal placental implantation, premature separation of the normal implanted placenta. Next is usually the precipitating factor of this is yung 8 weeks of AOG occurs during the first trimester of pregnancy. So, if all of these risk factors or like one of these risk factors causes complications with the pregnancy, then during the 8 weeks of age of gestation, mas malaki yung chance of having an abortion because hindi stable yung condition ni baby inside. Ayan. So, after the risk factors, magiging, ito na, implanted egg slightly separates or tears from the uterus. Ito na yung result ng mga complication na cause nung mga risk factors during the first trimester. So, implanted egg slightly separates or tears from the uterus. Ayan. So, unti-unti siyang re-regress and then nagkakaroon na ng mga tears or separation between the placenta and of course the uterus. Ayan. Blood collects between the chorionic membrane, a membrane that develops around the fertilized egg, and the wall of the uterus. Since may separation, of course, magkakaroon tayo ng bleeding inside. So, yun na yung makikita natin or mga objective data na makikita natin as a nurse when it comes to abortion. May bleeding present. So, blood leaks in the cervix. So, it will possibly result to abortion. Next is for the signs and symptoms of abortion. So, the most common sign of abortion is, of course, vaginal spotting. So, it appears as small, brownish to reddish spots of blood coming out from the woman's vaginal opening. This usually occurs when the cervix slightly dilates because the woman may have tried to lift heavy objects or mild trauma to the abdomen occurred. So there are a lot of possible causes of abortion, kasama na dyan si trauma. That is why when it comes to the early times of pregnancy, it is dapat regulated yung activities ni mother. Hindi naman siya na-restrict from doing physical activities. It's just that kailangan i-limit yung mga strenuous activities na possibly mag-exert ng effort that could lead to abortion. Next is yung vaginal bleeding. So bleeding is a serious occurrence during pregnancy because it might indicate that the cervix has opened and the products of conception might be expelled. So pag may bleeding, pinaka sign na yan ng possible abortion kasi may problema sa attachment ni baby. Next is yung cramping, sharp, dull pain in the symphysis pubis. So this occurs on both sides and could be caused by trauma or premature contractions that might cause cervical dilatation. And syempre, pag nagka-cramps yung baby, nagka-cramps yung symphysis pubis, pwede siyang magkaroon ng contractions within the uterus, and that might expel the products of conception. Next is uterine contractions. Ayan nga, contractions. It is usually felt by the mother, and uterine contractions can be false or true, but either of the two could be alarming during early stages of pregnancy because it could expel the contents of the uterus, thereby leading to abortion. Yan. Next is for diagnostic tests. So how do we diagnose abortion? First is yung pregnancy test. This is to confirm that the pregnancy first if vaginal bleeding occurs. So if test turns out negative, then the woman would be subjected to other diagnostic tests that could confirm the nature and cause of the vaginal bleeding. So if it is positive, then abortion would be considered and it would be classified according to the presenting signs and symptoms. Syempre, of course, most cases, si mother or lalong-lalo na sa teenage pregnancy, hindi masyadong aware yung mother na pregnant pala siya. So, first muna, before we suspect an abortion, of course, dapat pregnancy should be confirmed first. Yan. That is why pregnancy test is important. Next is yung ultrasound. This is the one of the diagnostic tests and also used as a preventive test that can help in managing or treating yung abortion. Kasi titingnan kung ano yung cause ng abortion. Ganun. The safest and confirmatory test for pregnancy and the ultrasound would be available to confirm if the pregnancy is positive and also confirm if the products of conception are still intact. Ayan. It is to ensure or to help the healthcare provider in giving out treatment regimen for the mother. So the only thing that we should always remember when it comes to abortion or any bleeding in early stages of pregnancy is to avoid any vaginal examination. So any invasive procedures or tests that would include vaginal penetration should be avoided kasi any bleeding in pregnancy means it has a problem or there is a problem with the baby. So that is why vaginal examination should be avoided. Next is for medical management. First is administration of intravenous fluids such as lactated rangers. IV therapy should be anticipated by the nurse, as well as administration of oxygen regulated at 6 to 10 liters per minute by face mask to replace intravascular fluid loss and provide adequate fetal oxygenation. Since there is a bleeding, it is important that we ensure that the mother or the fluid inside the body of the mother is well regulated. Next is to avoid vaginal examinations. The physician would also avoid further vaginal examinations to avoid disturbing the products of conception or triggering cervical dilatation. So, since there's a bleeding, it is important to keep yung vagina or yung cervix closed to avoid expelling or to avoid expelling the baby or the fetus inside. Next is for surgical management. So, ang surgical management, this usually happens if the abortion or the fetus wasn't able to survive. So, it happens when sa incomplete, missed, and basta if there's still a products of conception inside. So, first is yung dilatation and evacuation. So, this is to make sure that all products of conception would be removed from the uterus. However, before undergoing this intervention, the physician must be sure that no fetal heart sounds could be heard anymore, and the ultrasound must show an empty uterus. So, since there's still a possibility that the baby can survive, it is important to first ensure that the FHT or the FHT is already gone. Kasi if buhay pa pala si baby, may mga interventions din naman na pwedeng gawin si healthcare provider to help the baby survive and to help continue the pregnancy. Next is dilation and curettage. This is the most commonly performed or for incomplete abortions to remove the remainder of the products of conception from the uterus. Since the uterus would not be able to contract effectively, the contents might be trapped inside and could cause serious bleeding and infection. Since first trimester pa lang naman, yung contraction ng uterus is not really that strong and effective when it comes to the evacuation of the uterus. Kasi yun yung pinaka-purpose ng contraction is to evacuate the uterus or to deliver a baby. Pero pag first trimester, there's still some parts that cannot contract by itself. That is why it is important to like my assistance from the surgeon, from curettage, parang scrape yung inside ng uterus to remove all of the products of conception. Next is nursing assessment. Starting from assessment, assess for the following subjective and objective data. First, vaginal bleeding, ranging from light spotting to heavy bleeding. So we could measure the amount of blood loss of the mother, and abdominal pain or cramping, which can be mild to severe, and passage of tissue or clots from the vagina. So we should check if all of the products of conception are complete, starting from the fetus, and decrease in pregnancy symptoms such as breast tenderness or morning sickness, and back pain or pelvic pressure, signs of infections such as fever, chills, or foul-smelling discharge. Next is nursing diagnosis. Nursing diagnosis includes pain related to uterine contractions, and high risk for injury related to increased blood loss, and anticipatory grieving related loss to expected baby, since it is abortion, there's a loss of anticipatory grief or grieving loss from the mother. Then the risk for infection, including pelvic inflammatory disease related to dilated cervix or open uterine vessels, or minsan infection yung nauna before abortion. Then acute pain related to uterine cramping secondary to the expulsion of some products of conception, and fluid volume deficit related to profuse vaginal bleeding secondary to incomplete abortion. Next, for the nursing interventions, if the bleeding is profuse, place the woman flat in bed on her side and monitor uterine contractions and fetal heart rate through an external monitoring. So this usually happens sa threatened, or these are usually performed sa threatened abortion. We should monitor yung FHT and the fetal activity of the baby inside. Then also measure intake and output to establish renal function and assess the woman's vital signs to establish maternal response to blood loss. Ayan, titingnan natin kung magkakaroon ng shock. Possible magka-shock si mother, hypovolemic shock due to the severe dehydration. Then measure the maternal blood loss by saving and weighing the used pads. Yan. So, to measure yung bleeding ni mother. And then, save any tissue found in the pads because this might be a part of products of conception. So, that's it for my presentation. Thank you for listening.